Joining us now, Democratic Congressman Jason Crow of Colorado. He's a combat veteran and member of the House Armed Services Committee, as well as the House Intelligence Committee. Congressman, thanks for being with us this morning. As this recess for the summer gets underway, what are you hearing most from your constituents?
Well, my colleagues are absolutely right. Economics, the cost of housing, the fact that it is excruciatingly difficult to raise a family in America today, those are the things that remain our top priority. But that doesn't mean that we don't talk about rank corruption and rank hypocrisy, right? It's a false choice to say, do we talk about Epstein or do we talk about everyday kitchen table issues? We can do both, right? The focus should continue to be on the issues that Americans are struggling with, and it will be. But listen, Donald Trump clearly does not want to talk about this. He clearly wants to sweep this under the rug, which is telling. I mean, desperately, he's trying to get rid of this story, which says that, there's something that people should be concerned about.
It seems to me, Congressman, this isn't a hard sell. I mean, you have a bill. Republicans voted to take away doctors from Americans that live in rural states, to take away pediatricians from children, to take out basic health care services, basic health care coverage, and also take food out of children's mouths. I mean, and you look at the polling, a lot of people say, oh, well, that food assistance, it's probably not very popular with middle America. Well, no, actually, Republicans are upside down on slashing food assistance for children, slashing food assistance for the most needy among us. And where's all that money going? For the cuts? Shutting down rural hospitals, shutting down nursing homes, shutting down health care for Americans in red and blue state America. It's going to tax cuts for billionaires. It's going to corporate welfare for multinational corporations, for oil companies. I could go on and on and on. This is not hard. They stole from the poor to give to the rich. Seems to me Americans don't think that's fair. They don't think that's right. And they don't think that's what they want in Washington.
Well, because it's not. Right? This is the single largest transfer of wealth in American history from the middle class, from the American middle class and working class to the top 1% and billionaires. That is simply just a fact. Right? And even if folks say, hey, I'm not on Medicare, I'm not on Medicaid, I don't use these programs, which some people say, I point out you can't remove $1 trillion from the healthcare system and not have it impact everybody. You think it's hard to get an appointment now? You think it's hard to find a healthcare provider now or to access a clinic? Just you wait until all of these hospital closures happen, until people leave the profession, before nurses and doctors say enough is enough. There are thousands, tens of thousands of healthcare practitioners who are right on the verge of leaving the profession now because they just can't stay afloat. This is going to put them under. They're going to leave, and this is going to send shock waves through the entire system. So that's what this bill is about. This is the worst piece of legislation that I have ever voted on in my time in Congress, which is saying something because I voted on some terrible things, and people see it, and it's going to impact red communities and Republican districts the worst.
And people who aren't on Medicaid, may not be on Medicaid, may think it doesn't affect them. When they try to put their parents into nursing homes, into facilities to take care of their elderly parents, they're going to find out that those nursing homes are funded by Medicaid. So, Mike Barnicle, healthcare is in a crisis state, whether Americans fully understand that or whether Washington politicians understand that. These additional cuts, so billionaires and monopolists and multinational corporations can continue to get massive tax cuts. They're going to feel the weight of this. There's going to be a longer wait time. There's going to be longer delays for their health care. And then you look at the private health care insurance scam. I mean, it used to be we would say in this country, oh, we could never be like Canada because Canada, they've got a single payer health care system. And sometimes it takes 6 months to get an appointment with your doctor. Well, now, because of private insurance companies, that's exactly what's happening. Oh, you're not in this network. Oh, we're going to deny that. Oh, we're going to deny this. Send us more papers. More papers are sent in. Oh, we've got it tonight. Oh, well, you'll get this appointment in 6 months. You get the appointment in 6 months. And then 3 weeks before that appointment comes up in 6 months, you know, I've read reports that then they send another paper going, no, well, actually, this isn't going to work out. You're going to have to file additional. It goes on and on and on. And these insurance companies are making hundreds and, you know, just billions and billions of dollars on rejecting people's insurance. You add that with slashing Medicaid, with all the cuts in the healthcare system, we're going to end up in worse shape than Canada, because it's going to be taking longer and longer to get healthcare from physicians. If you can even, as the congressman said, if you can even get the physicians, because they're going to stop practicing because they're not getting paid.
Joe, everything that you just mentioned has been going on for quite some time. And Americans have been paying the burden. They've been carrying the burden for this, the cost of this for quite some time. That's what's leading to what they call concierge medicine. I mean, people with money now go into groups where they pay a doctor a specific sum and they get automatic treatment. For the vast majority of people, that's not an option. It's odd that we're talking about this right now, because 60 years ago today, Lyndon Johnson signed Medicare into law. And he turned at the signing ceremony in the White House and gave the first Medicare card to former President Harry S. Truman, who thought about the idea of Medicare back in 1948, 1949. A Democrat. And Lyndon Johnson, a Democrat, signed Medicare into law. Congressman, today, 60 years later, what do the Democrats stand for in terms of health care for the average American, who are getting killed by health care premiums and car insurance premiums, both sides going up, skyrocketing up? What do the Democrats stand for? What has happened to the Democratic Party's voice on this?
We do have a strong voice on this. We stand for quality, affordable health care. But when I go around the country and around my district, I find almost nobody who thinks the system is working well. Even if you have the platinum program through your employer, as you all pointed out, this system is vastly inefficient. No country spends as much as America does for as worse outcomes as we get, right? We spend multiples per person more than most other countries for poor results, right? So reform, I'm a believer in a single payer system. There's different ways that looks like, but I think we can get there. The idea that the United States of America is somehow locked into a system that is more expensive and delivers worse results than other countries. I mean, what the heck? That's not America, right? We're supposed to do things better, more efficiently, quicker. And yet we're not doing it with this system. The system has failed and continues to fail and get worse for millions of Americans. So we need to reform that system. We can get to a system that provides access for everybody.
Jason, another adjacent topic to this is the cost of pharmaceuticals. Mm-hmm. The Biden administration made real progress in terms of negotiating lower prices in Medicare pharmaceuticals. I noticed in the deal that Trump made with EU, there's going to be a 15% tariff on pharmaceuticals. And there's people don't realize how many pharmaceuticals come into this country from Europe. A huge number of drugs that are consumed in this country are actually manufactured in Europe. So, you know, here we are, Biden administration actually lowering costs on everything from EpiPens to other drugs. And now we've got the Trump administration that's putting a 15% surcharge on all the drugs coming in from the EU. What, if anything, is percolating among Republicans? Don't they realize that the drug costs are a real loser for them?
They're so hell-bent on just trying to destroy anything with Joe Biden's name on it that they're forgetting the fact that the Inflation Reduction Act was one of the most consequential health care and prescription drug price reduction legislation in the history of America. Right? We fixed the price of insulin at $35 a month, which saved Americans hundreds of dollars. We allowed the government to negotiate with Big Pharma, which the pharmaceutical industry fought us harshly
Tooth and nail,
right?
for
Tooth and nail.
a decade.
I mean, Clara, you know that for every member of Congress, there are 3 lobbyists for Big Pharma that just flood the Hill, right? Trying to get us to not reduce costs, trying to get us to protect the American pharmaceutical industry against what you said, European drugs, other drugs. Why wouldn't we be open to better, cheaper drugs if they happen to be produced somebody else, if that's good for Americans? And the reason, of course, is because of the rank corruption of this administration that is establishing walls and listens to Big Pharma and the lobbyists that flood Washington, D.C. That's why.
Congressman, let's turn you now to overseas, please. In the situation in Gaza, the famine there. We heard from President Trump in the last couple of days disputing Prime Minister Netanyahu's claim that the starvation was not happening. He broke with the Prime Minister on that. But he has not pledged any real concrete action yet. What, in your estimation, first of all, should his message be to Prime Minister Netanyahu right now? And secondly, what more can the U.S. do to help the people there in Gaza?
There needs to be a massive surge of food aid immediately. And any of us who have been watching this have seen this coming for a very long time. I was with Cindy McCain in March. And of course, she's the head of the World Food Program. And she said back in March that there was no food aid going into Gaza. So this is not a surprise. This has been a catastrophe that's been building for a very long time. And it's time for this administration to get serious about what is just unbelievably heartbreaking conditions, these images of children starving to death, right? The system, the food aid distribution system is failing terribly. And it needs to change, the entire distribution system. We need to rely on independent humanitarian organizations who actually know how to do this instead of military and paid contractors. There are professionals that know how to distribute aid quickly and effectively, so they need to be put back in the driver's seat. And we need to push to make sure that Hamas accepts the ceasefire deal that's been on the table, and that they release hostages and that we get a permanent ceasefire so we aren't in this position of constantly having to rearrange or change the way the distribution of aid is done. So these things need to happen, and Donald Trump is in the position to put pressure on the parties necessary to get it done.
Democratic Congressman Jason Crow of Colorado. Congressman, thanks so much. We appreciate it.